Autism is a complex, lifelong developmental disability that typically appears during early childhood and can impact a person's social skills, communications, relationships, and self-regulation. Autism is a certain set of behaviors and is a spectrum condition that affects people differently and to varying degrees. Autism or autism spectrum disorder refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and non-verbal communication. Autism is also called autism spectrum disorder, ASD. It means your brain works in a different way from other people. There are other names for autism used by some people, such as autism spectrum disorder, ASD, the medical name for autism, autism spectrum condition, ASC, used instead of ASD by some people, Asperger's or Asperger's syndrome, used by some people to describe autistic people with average or above average intelligence. What are the symptoms of autism? Autism symptoms typically become clearly evident during early childhood, between 12 and 24 months of age. Symptoms that hurt the people's ability to function properly in school, work, and other areas of life. Repetition in language or movement, such as repeating the same word or sounds, hand flapping, or any repeated movement. Prefers solitary or parallel play rather than engaging in associative or cooperative play with other children. Strong, persistent interest on specific topic, part of a toy or item. The DSM-5 divides symptoms of autism into two categories: problems with communication and social interaction, or repetitive patterns of behavior or activities. Causes of autism. The scientists don't know the exact causes of ASD. Research suggests that genes can act together with influences from the environment to affect development in ways that lead to ASD. Although scientists are still trying to understand why some people develop ASD and others don't. Some risk factors include: brain scans show differences in the shape and structure of the brain in children with autism compared to in neurotypical children. Some of the suspected risk factors for autism: having a sibling with ASD, having certain genetic conditions. People with conditions such as Down syndrome, Fragile X syndrome, and Rett syndrome are more likely than others to have ASD. Genetic mutations. Fragile X syndrome and other genetic disorders, being born to older parents, low birth weight, metabolic imbalances, exposure to heavy metals and environmental toxins, a history of viral infections, fatal exposure to the medications valproic acid or thalidomide. Diagnosing ASD. Doctors diagnosed ASD by looking at a person's behavior and development. ASD can usually be reliably diagnosed by the age of 2. It is important for those with concerns to seek out assessment as soon as possible so that a diagnosis can be made and treatment can begin.